press briefing. My name is Andy Baston. I'm the Kankakee County EMA Director. So the reason that we called you here today, we have a confirmed case of COVID-19 in the area, and we are going to turn this over to the experts from each jurisdiction. This is something that we've been working on, a collaborative effort with everybody for probably the last 2 weeks or so, multiple meetings, phone calls, webinars, and such, preparing for this to happen today, and we are prepared for this. So some of the key role players that we have here is Riverside Hospital, the Sheriff's Department, the Health Department, St. Mary's. Some of the other players that are involved here that are with us is the Mayor's Association, the Chief of Police Association, the Fire Chief Association, the Illinois State Police. So at this time, I'm going to turn it over to Phil Cambick from Riverside Hospital.
Thank you, Andy. I am Phil Cambick, President and CEO of Riverside Healthcare in Kankakee here. I am going to read a prepared statement and then turn it over to my colleague from the County Health Department. And later in the program, we're going to have a question and answer where I'll come back up if needed. So, like many hospitals across the country, Riverside Medical Center has now confirmed a positive case of COVID-19. The male patient in his 70s was evaluated in Riverside Emergency Department and was sent home to be quarantined, consistent with the standard of care given his symptoms. In anticipation of cases like this, Riverside has been preparing and will continue to follow proper protocol. The hospital has restricted all visitors at this time. We will continue to coordinate with the Kankakee County Health Department, the County Emergency Operations Center, the Illinois Department of Public Health, and the Centers for Disease Control and Prevention. There will be a coordinating press conference for the county today, which we're having. The care and safety of our patients and staff remain our highest priority. We recommend following the CDC guidelines to stop or slow the spread of the virus by washing hands frequently, staying home when sick, and covering coughs and sneezes. Thank you.
Good afternoon. My name is John Beavis. I'm the administrator for the Kankakee County Health Department. So I'd like to read this press release that we have prepared for you today. The Illinois Department of Public Health has confirmed the first positive case of corona disease, COVID-19, in Kankakee County. It is important to remember that even though there has been a confirmed case, this is not cause for panic. I repeat, this is not cause for panic. We want to make sure that that message is clear. The Kankakee County Health Department is, and will be working closely with the Illinois Department of Public Health, Amita St. Mary's, Riverside Hospital, to prevent further spread of the disease. We strongly recommend to continue social distancing and other safety measures, which include staying home as much as possible. If gatherings are necessary, limiting the number of people to 10 or less. Calling to check on family, neighbors, and older adults instead of visiting them. Checking with your provider about telehealth options if you feel ill. Remember to continue using proper hand hygiene. Cover your nose and mouth with a tissue or sleeve when sneezing or coughing, and then throw that tissue away. Do not shake hands. Instead, you can wave or do the elbow bump that a lot of people are doing today. Most importantly, this is very important, we cannot stress this enough. If you are sick, stay home. Avoid the emergency departments and other places you normally seek health care if you are not seriously ill, unless your doctor advises otherwise. Stay home and help to keep the health care access available for others who do have more severe illness. If you have a respiratory illness, stay home for 7 days after your symptoms have started. So if you are feeling respiratory illness, please stay home for 7 days after your symptoms have started, and for 3 days after your fever has stopped, without the use of fever-reducing drugs. doesn't mean I took fever-reducing drugs, my fever's gone, and now I can go out. It needs to be 3 days without. And your cough or sore throat symptoms have improved. When should you consult your doctor? If you have a fever, a cough, or shortness of breath, or other cold or flu-like symptoms, and you do not feel better after 3 to 4 days, that's when you want to contact your physician. Use the telephone, text them, telemedicine, or a patient portal, whatever is easiest for you to use, to reach out rather than going to the doctor or to the emergency room. When you should consult your doctor also, you are an older adult or have chronic health conditions of concerns, such as heart disease, diabetes, lung disease, and are exhibiting mild symptoms. Unless you and your provider will decide if you need to come into the medical care. You usually do not need to be tested unless you are admitted to the hospital. Important notes to know about getting tested. Most illnesses caused by the coronavirus are mild. IDPH, the Illinois Department of Public Health, currently recommends against testing persons with mild illness who can be safely managed at home. I repeat, IDPH is currently recommending against testing persons with mild illness who can be safely managed at home. The recommendation is to self-quarantine at home, stay home for 7 days after your symptoms have started, and for 3 days after your fever has stopped, without the use of fever-reducing drugs, and your cough or sore throat symptoms have improved. This minimizes the possibility of exposures to healthcare workers, patients, and the public, and to reduce the demand for the personal protective equipment, otherwise referred to as PPE. If you think you have COVID-19 and your illness is mild, and you are not older or with underlying health condition or of concern, you do not need to see your doctor. It's being recommended that you do not need to see your doctor. Getting tested will not change how your doctor will take care of you. If you do not feel better in 3 to 4 days, then call your provider and discuss the next steps. Due to the limited capacity of testing, Riverside Healthcare and Amidas St. Mary's will prioritize the testing to those patients with severe acute lower respiratory illness or those who meet IDPH criteria for testing. Let me please repeat that one more time. Due to the limited capacity of testing, Riverside Healthcare and Amidas St. Mary's will prioritize the testing to those patients with severe acute lower respiratory illness or those who meet Illinois Department of Public Health criteria for testing. For general questions about COVID-19, you can call the IDPH COVID-19 hotline at 1-800-889-3931. That's 1-800-889-3931, or email dph.sick@illinois.gov. That's D as in dog, P as in Paul, H as in hot, .sick, S-I-C-K, @illinois.gov. For information on actions you, your school, your workplace, or the community can take, please visit Preventing COVID-19 Spread in Communities at dph.illinois.gov/topics-services/diseases/AZ list coronavirus/preventing spread communities. For daily updates on COVID-19 in Illinois, follow the IDPH Daily Updates page at dph.illinois.gov/topics/service/media-z-list-coronavirus/media-press-briefings. That's all I have in regards to the prepared statement. I would like to say from the health department standpoint. Okay. I'm sorry.
Speak into the mic, though, please.
I would just like to confirm, with the positive case, the health department is working, has CD nurses who are coordinating and confirming the diagnosis from IDPH. The next step would be to notify the provider, which has already been done. We confirm the patient is in isolation and or whether or not full PPE is adhered to. If they're not hospitalized, then we confirm the patient is being isolated at home and other family members are being appropriately managed. If healthcare exposures exist through the investigation, for example, it's a hospitalized patient, there was an emergency room visit, we notify the infection control professional at that location. We are conducting the investigation in regards to the quarantine contacts per Illinois Department of Public Health guidance. So we will contact any employers or schools as needed. We will issue orders of quarantine. We will isolate the case away from the well people. We will continue monitoring, and we will be testing only recommended for those who meet the criteria. So we will follow the directions set down by the Illinois Department of Public Health. At this point, I will turn it over to Andy Wheeler, the chairman of the county.
Thanks, John. Apologize for that, those that are watching at home. We hopefully have got it corrected now. We started this process roughly a couple of weeks ago. The county is this is the Emergency Operations Center. We're not active, if you will. What we've done is we're acting as the coordinated point of information as this evolves and goes forward. Obviously, there'll be changes and updates, but I do want to remind everybody what we're doing here is to make sure that everybody has the same information and then pointing that right to the health department's website and Facebook pages, so they are that point of information. We want to make sure everybody has the latest and most up-to-date as things are going here in Kankakee County, and this is the best forum to do so within this confines, and we're all working together in that effort. We've been planning for this. We were hoping it would be a little bit later, but we looked at it more as an eventuality rather than something that may or may not happen. So the county's role in this is a facilitator and as the county government, but there are things that we can do to help bring resources to the area, and one of the things is today, and you've heard all the whereases and proclamations, there's lots of whereases, but in this one, you've heard why we're doing this. And so today, by virtue of authority, I just signed this, the authority vested in me as the County Board Chairman of Kankakee County, Illinois, pursuant to the Illinois Emergency Management Act of 20 ILCS 3305/1, proclaim that a disaster exists within Kankakee County, Illinois, and it's effective March 19, 2020. So once this is executed by our county clerk, this will be sent in, and hopefully then we will start to open those doors, access for PPE as it becomes available, as we talked about, because there is a shortage of that, the masks and everything else that's needed on the local level, but we're going to move forward and rely on our partners both locally but also in Springfield to help bring those resources to Kankakee County as they become available. So really, the only other thing I have to say is I really appreciate everybody's coordination and planning for this event. The EMA is established to do things just like this. Obviously, there is no page in the book that says pandemic, so everybody is kind of learning what to do as we go along, and we're coordinating with other areas on what their best practices are coming from this. So with that, I'd like to introduce Senator Patrick Joyce. He was joining us today, and he's had a couple of comments that he wanted to put to the group.
Thank you, Chairman Wheeler. First and foremost, I want to thank the chairman for taking the lead on this, and also our local hospitals. I've reached out to all of them to make sure that they have all the information they need. We are here to help and to dispel rumors, make sure that you get your information from a local elected official, the public health department, the Kankakee Health Department. Make sure your information is coming from those sources to dispel any rumors that might be out there. We are having currently every 48 hours a statewide conference call, and we have a direct line to the governor. So as we go through this, just want to make sure that our office is there to help with resources. So I just wanted to thank Chairman Wheeler on that, and to make sure that everyone knows that our office is there for a communication hub if needed through the governor's office. So Thank you very much.
All right, now we'll go ahead and open this up for any questions that you guys would have, and I'll try to direct it to the proper subject matter expert here.
When did this gentleman come into the hospital, and when was it actually confirmed that he was indeed suffering from this illness?
Phil?
If we could just repeat the question, we're gonna use the microphone right there for you guys in the media.
I'm sorry.
That way the public's hearing the question.
When did this individual come into the hospital, and when did the hospital learn that he was indeed positive?
Great question, Lee. He came in 2 days ago into our ER with flu-like symptoms. He qualified for the COVID-19 testing, and I'll get to that in a moment. So again, over a certain age, he was over 70, had influenza-like symptoms, and so we brought him in. Right when he came to the ER, because he has a respiratory disease, we put a face mask on him, and we took him to a negative pressure room. All of our caregivers who treated him went in with face masks as well, so they were protected. We did the nose swab. Nobody in town can actually do that test. So our lab at Riverside and the lab at St. Mary's, none of the labs in town can actually do the COVID-19 test. We have to send it out. So we send it out to the state lab, or we send it out to Mayo currently. That turnaround is 48 hours. So as this patient, we treated that patient, we sent him home with instructions to self-quarantine. We followed up with the patient, and then the lab test results came back late last night. So we've reached out to the patient, we've coordinated with County Health, they're following up with the patient as well, and we reached out to him this morning.
So just to confirm, Phil, he came in Tuesday or Monday?
Monday.
Came in Monday.
What is today, Lee?
Thursday. Okay, I just
What can you tell us about the patient? Where is he from? Who may have been
You know,
exposed?
At this point in time, we can't release any of that HIPAA type of information. I can say, and we've coordinated with the county, they're doing that follow-up to who was, they have a whole process of who did he come into contact with, reaching out to those folks, self-quarantining those folks. So they've got a whole process in place that they're following. And because this is still very, very fresh, we can't release any of those details.
I would like to ask a question to the health department. John, you reiterated there is no need for panic. Obviously, that's one of the first places people go. How do you prevent people from getting carried away and overreacting to this?
The first and foremost thing is that we advise the public to be educated and get their information from the same source and not necessarily just off of social media. So the health department, the hospitals, a number of county agencies have been and will continue to be working together to promote the same message of what needs to be put out for the public to try to alleviate. The more educated anyone is about a particular matter, the more calm and their fears are become. So as Chairman Wheeler said, the health department is going to be the main mechanism here in regards to pushing information out to the public on, what is COVID, who, what, where, when, how, why, on everything that we need to do, and moving forward, what does the public need to do or be aware of until conditions change and we're directed otherwise. And then just make sure that message keeps getting out there. We'll keep promoting it and doing what we do.
So this patient is obviously in self-quarantine right now. That means he is likely at his home?
Correct. Self-quarantine at this point would be an individual within their home, their residence, unless an individual is hospitalized, which in this case they are not. So typically, as another case comes up or more cases come up, that is part of the investigation to then get that person, once they're positive, into a quarantine state.
Do you have a timeline as to how long this person may be required to be in quarantine?
Typically, it's the 14 days, unless directed differently by the doctor and or conditions become worse, then they may then need to be hospitalized or put within a medical facility, but typically it seems to be 14 days, the conditions seem to improve.
Okay. Now that we have had our first case and as testing appears to be getting ramped up a little bit now, are we anticipating more cases now?
Well, we were expecting a case, and here we have it today, and so I would expect that, you know, for example, Will County the other day had their first case, and now I believe they're sitting at 3 or 4. So I would anticipate as more tests are taken, more positives will begin to show up, and then we'll begin to treat those all in the same manner in which we're treating this one. An investigation will take place to determine their exposure, their contacts, where do they work, who do we need to contact, and then let those individuals who are in and around that individual determine what they want to do within their business or employer.
We now have a community where our schools have been shut down and various other activities and events have been shut down. Do you have any timeline? I got my question I'm getting to is, would you expect schools, public schools, to be out of business longer than the end of March, which is where they have targeted as of right now?
That's a good question. I am not at liberty to necessarily say. You know, some of this direction is coming down from the governor or potentially the president in regards to their directives. So, you know, at the health department's level, we're doing what we can do there. We're pushing out the information that we can in regards to any of those directions. My understanding is that right now the governor had said the schools would be closed until March, the end of this month. I'm sure that will be looked at, and it could be extended, it could be lifted. I don't know.
Phil, you have anything to add?
Yeah, I will. I think John did a very nice job of describing the situation here. I'm going to put a different twist on it. And you know me, ladies. We're going to have more cases, right? It's that simple. The more we test, and we're only testing the very sickest of the sick, we're going to have more positives. And that's okay. We're ready for it, right? How the newspapers and the radio stations and social media can help us is to say, don't panic. COVID-19 is a type of flu, right? Mm-hmm. The symptoms for COVID-19 are identical if you get the seasonal flu, right? You're gonna feel bad. You're gonna have a fever. You're gonna have some body aches. You're gonna have a sore throat, et cetera, et cetera. If you are under 60, which I can still claim, and you're healthy, ride it out, right? Stay at home, stay in bed. Again, we have great people that work at Riverside and at Amita and at the county. They want to come into work and they want to bear through it. We need you, if you're sick, stay at home, stay in bed, take ibuprofen, take cough medicine, take what you need, and ride it out. If you have mild to moderate symptoms, don't flood the ER, because you're more likely to catch it in one of our ERs than you are if you stay at home and ride it out, right? I'm making it that simple, guys. And so again, there is good practical guidance coming from Illinois Department of Public Health. The other thing I want to touch on, and again, I don't want to upset the president or the governor or anybody else, so forgive me, Senator Joyce. COVID-19 testing, everybody wants to say, oh yeah, it's readily available. If you come into Riverside or St. Mary's or anywhere else, you're not going to get tested, Lee, because I don't think you're over 60, right?
They're not.
Right. And you don't have all of these severe symptoms. And so, again, the worried well want to get tested. And quite frankly, there's no need for it, right? If you have moderate to low to mild to moderate symptoms, you're going to go to your doctor, you're going to go to the ER, we're going to send you home and say, take care of yourself. Stay in bed, rest, drink lots of fluids, don't overdo it is what I'm hearing. Take ibuprofen, etc. That's what we're going to tell you to do. It's though if you are over 60 and you have severe symptoms, by all means, come to the ER. You're the patients that we need to treat, and we need to isolate. We've put in precautions at both hospitals. Once you walk in the door of the ER, we're gonna pre-triage you. Do you have flu-like symptoms? If you say yes, we're gonna put a mask on you right away, because we wanna protect you, we wanna protect our staff. We're in this for the long haul, right? Once you say yes, we put a mask on you, we're gonna take you to one of our negative pressure rooms to protect everybody, including the patient. We're gonna have our providers, so our doctors and nurses and NPs, what have you, mask up and go in to see you and treat you. If you're really severe, we're gonna admit you to the hospital and take care of you there. Most likely, we're probably gonna say, yep, you've got the flu. We need you to go home and rest. And if it doesn't get better in a few days, call us, right? That's what we need to do. People who have flu-like symptoms, mild to moderate, don't go to the grocery store. Don't go into public places. Do yourself and your friends and family and community a favor and stay at home and rest and take care of yourself.
I've seen many stories, Phil, regarding younger people who may not be taking this as seriously as others or as they should. What is your advice to to those in their teens, 20s, that age group that
Right.
may not
Absolutely.
be as affected?
I will say, and again, I probably should ask Dr. Phillips to come up. I want to introduce Dr. Martin Phillips. He is our medical director of our infectious disease department. He works at both Riverside and St. Mary's, does a great job for us. He's the expert. So before I put my foot in my mouth or something, let me have Martin say a few words.
Good afternoon. Good afternoon. To answer your question, they need to take it seriously. They are young, they are healthy, and for the most part, they will do okay. But they need to take it healthy, because aside from the fact that they can get sick and be mild, they can go ahead and spread it also. So they've got to take it seriously, practice appropriate hygiene that's recommended, social distancing, stay at home if they're sick, don't flood the ERs as has been repeatedly stated. So they should take it seriously.
Okay.
So just want to say real quick, it's also been stated several times already that population needs to stay calm. We do expect, as Phil just said, lots more cases to test positive, and there'll be a lot more cases in the community ultimately. What percent will get sick and what percent will get really, really sick, we do not know. So we're recommending that you just stay calm, follow the recommended guidelines you've heard today. If necessary, you call the hotlines or you call your physician and follow the advice, and try to stay abreast with what has been published on the Kankakee Department of Public Health websites, as well as the IDPH and maybe CDC.
Any more questions, gentlemen? All right, so we're going to conclude this today. The EOC and all the stakeholders are going to still stay in place, continue to work on this, and if anything new comes up, we'll get a hold of you guys for updates. In the meantime, the local health department's website and Facebook page will be the main source of information, and everybody else in the room will also share that exact same information.
Ask businesses to also share that information.
Yes, so if we could have all the businesses, the more people that see this, the better. All the guidelines that we have. So if we can have everybody share the official statement and the official guidelines, that's going to make everybody just a little bit more educated on this, and hopefully we get through this properly. All right, thank you.